Hey everyone, today's video is about how to do a figure 8 tensor bandaging at the knee joint. Before we go into the technique, I just wanted to show the different lengths of tensor bandages which are available and which can be used for what joints. A joint like knee joint is definitely a little larger in size, so I will usually go with a 6-inch width. So you can see here, so that's a 6-inch width tensor bandage. And what I see here, this is a 4-inch and this is a 3-inch. A knee joint would definitely need something like a 6-inch because of the size of the joint. A joint like ankle would need something about like 4 inches. A joint like elbow or wrist would definitely, I think 3 inches would be sufficient to get a good grip and compression. So selection of bandage is very important and crucial for a proper compression, so that the idea is to reduce the swelling and also to provide a little bit of a compression in the area, so it just helps with the injury situation. Okay, let's get started. Okay, position the client comfortably in a bed or any position which eases the pain. It's important to keep the knee a little bit bent so that it's not straight. Now remember, a knee which is slightly bent is in a relaxed position, which would be ideal for completing your compression. Okay, so there we go. Let's get started. I'm going to take these pins off. Just put it aside. I'm not a too big fan of these pins because they can cause skin injuries. Okay, so it's important. Also remember, there's two sides to the bandages. There's a smooth side and there's a rough side. I don't want this touching the skin. It can form those creases. You don't want that on the client's skin. Okay, it's important you start distal and you end proximal when you're bandaging. So that's what it helps to assist with the drainage of any swelling or lymphatic drainage as well. Okay, so that's where I'm going to start. You can see that's a kneecap. And you can see here, that's the kneecap. So just below the kneecap, you're going to start. And what I'm going to do is a little bit of tension, not too tight, not too slack. See here? So I'm going to go start from here, hold it. And I'm going to do 2 overlapping wraps. Oops, let's start again. Okay, there we go. So you can see here, I did the 2 overlapping wraps. And now is the time where you're going to take that bandage, you're going to go at an angle. And you can see here, so that's an angle right over the kneecap. And now I'm going to come down at an angle. Make sure to just remove all the creases as you do it. There we go. And you can see the V over here. So I'm going to use this as a pattern to do the rest of the 8s. So you can see here is a line like an angle. I'm going to go up again. So you can see those angles right there. And I'm going to come down. As I come down, see, again, I'm making a nice loop. Again, there's another line. I'm going to use this as a reference. And I think looks like I have a length for one more turn. And I'm going to end my wrapping proximal, as I said. Just be very careful when you use these pins. If you got any tape or anything, you can stick it as well. So you can see here. So how it like overlapped with each other, and there ended on the top. All right, so this is how I do the figure 8 compression for the knee joint. Now remember, it should not be too tight. If the client feels any tingling or any numbness in the feet, you got to be careful. You may want to remove that, and then you got to redo it after a few hours. If it gets too tight, it can block the circulation too. All right, hopefully this helps.